Welcome back. We are here live with Dr. Wing Province from the Park City Hospital for an important discussion about where we are at right here locally with COVID-19. Dr. Province, I know how busy you are and I really appreciate your time with us today. How are things at the hospital?
It's sad to report that we have seen a spike in COVID patients at the hospital. I'd love to report that right now all we have are summer injuries and those sorts of admissions, but right now we've actually seen levels of COVID in our hospital similar to when we were at the peak of the pandemic a year ago.
And that is not what we want to hear, and I've heard some people call this a fourth surge. Would you agree with that?
It's interesting, Christine, but yes, I'd say it's another surge. We're seeing a lot more folks in the emergency department with COVID-19, and that's translating into admissions into the hospital. In fact, we've been asked by some of the larger COVID ICU centers down in Salt Lake to start accepting patients from their hospital to ours, not COVID necessarily from theirs, but just to offload medical patients from their facilities to create space there in their hospitals for COVID patients in their ICUs. And the same with us. We've had 4 to 5 patients in our hospital over the last few days, which for us is quite high. We've had several days, several months without anybody until recently. And I'd say the trend, though, is that the majority of these patients, I think 99% or 98.5% of those are unvaccinated.
Park City is a small hospital. It's an excellent hospital with many resources, but I believe you have a 4-bed ICU, so it can fill up rather quickly. Are you worried about getting to capacity within our hospital here?
It's always on the top of our mind. We worry about being able to meet the needs of the community. We're very fortunate, though, that at our hospital, we have those ICU beds. We have a plan where we can flex out, as we created March of last year to prepare for the pandemic, ICU flexible rooms where we can take a regular room and then convert it to ICU capabilities. So we have the ability to expand if we need it. And then we also have our sister hospitals throughout the Intermountain healthcare system where if we do hit too big of a surge where we couldn't keep everyone here, we could transfer them so they could get excellent care at another one of our facilities.
And you mentioned these patients that are hospitalized with COVID, they are not vaccinated. Is that true?
Yeah, that's the majority of the patients we're seeing are not vaccinated. And folks may think, oh, well, they're probably just the old folks who have a lot of medical conditions, but just reviewing our inpatient census this morning, they're not all old. We've had patients in their 30s that are here in the hospital all the way up to those folks who are in their 80s. So the majority of them are not vaccinated. And I should mention that the majority of them also are not from our county. They're coming from neighboring counties or are folks from out of town in other counties here in Utah who are here on vacation, who develop symptoms, and who come into the hospital. And we're just grateful that they do come in so that we can take care of them.
Yeah, vaccination rates are doing well right here in Summit County. It's been reported that it is rather high, but that's among residents who live here.
That's exactly right. I think the folks who live here in Summit County can be awfully proud of the work that they've done in working with our Department of Health, with the hospital, with our local pharmacies who have been offering the vaccination, and with our local primary care clinics, because we have one of the highest rates of vaccination in the whole country. And you can translate that to in the whole world because of how available the vaccine is here. So for Summit County residents, the vaccine is working in keeping them out of the hospital and preventing death. But for those who are visiting or who aren't vaccinated here in our county, those are the ones that we are seeing here. And it's not just being admitted to the hospital, but it's also quality of life impact. We are seeing a lot of folks here in this county who have long COVID, who either weren't vaccinated because they didn't have the option to be vaccinated at that time, or have the option and are getting COVID currently, and just seeing a significant decrease in their quality of life, not because COVID is going to take their life, but because of the long-term effects that this disease can have.
We've heard some reports of a few breakthrough cases right here locally, meaning people who are vaccinated and still get COVID-19. How concerned are you about that? And have you seen very many severe cases of individuals who come down with COVID-19 and have been vaccinated?
Yeah, I think people need to be aware that the Alpha variant, or the Alpha virus that we had back in March, is very different from this Delta one that we have here, and we can keep going through the Greek alphabet, and who knows what we're going to have in a few months. Largely, the variants come because the virus gets in folks who aren't vaccinated, and then it can mutate. So to your question about, how worried are we? I think we're worried in the sense that we do see occasionally some breakthrough cases. But those folks are typically asymptomatic, or they have very minimal symptoms and they don't require hospitalization. So in that sense, we take great relief in seeing that the vaccine is actually working in preventing death and hospitalization, which is the goal of the vaccine. But as more and more variants come about, we have to look at the research and look at what the science is showing. And really the best way to protect ourselves against this Delta variant that is now here, that came to us from India, is it's very contagious, 4 times more contagious than what we were dealing with back in March of 2020. And really the best way to protect ourselves and to protect your neighbors and family members is just to go get any vaccine, and that prevents the virus from being able to mutate and create more complicated versions of itself.
And as families prepare to send their students back to school, are you concerned about the younger population that cannot be vaccinated, about them coming together, going to school with this Delta variant? I know it's impossible to predict the future, but I'm just wondering if that is top of mind for you as well.
It is, Christine, because I have 5 children who go to the Park City School District, and so it's very top of mind for me. 3 of those children are over the age of 12 of my own, so they've received the vaccine, the Pfizer vaccine, and I worry less about them, but I've got 2 younger ones who are going to be going to school, so I do worry about them. In our family, what we've done to protect the youngest ones is to make sure that everyone around them is vaccinated in our family, and I think that's what families can do at home in the summer, is to protect their youngest ones, the most vulnerable ones, is to make sure that everyone around them is vaccinated. But to your point about them going back to school, which I'm not allowed to use that phrase in my home because we're trying to enjoy summer and not focusing on school so much. But when the time comes, I think to protect them from the potential long-term effects that we're seeing with kids, because as you know, little ones don't seem to die from this virus, but they certainly aren't protected from the long-term effects from it. I'm going to follow my pediatrician's counsel and advice, which is to have our children wear a mask in school, even though the state no longer requires it in our schools. We're going to take the advice from medical experts and have our children who are not vaccinated wear a mask. And to be honest, maybe even have our older ones who are vaccinated wear a mask. That's something that we're going to have to discuss as a family.
Well, Dr. Wing-Provence, we so appreciate you taking the time out of your busy schedule to talk with us and give us this important update in real time about this COVID surge happening right here locally. Unfortunately, Park City Hospital, as Dr. Provence mentioned, is seeing an increase in patients, mostly unvaccinated, who are coming down with severe COVID-19. So that's not good news, but we are so grateful to everyone at the hospital, the staff, the doctors, for working tirelessly this entire pandemic to help keep our community safe. If you want more information about Park City Hospital, you can head to intermountainhealthcare.org. We'll be back with more here on Mountain Connections after this.